presenting paper with title of Outcomes of Cephalomedullary Nailing in the treatment of extracapsular proximal femur fracture and factors affecting it. So nowadays, hip fracture is a growing concern because of the significant morbidity and mortality. Projected increase from 1.26 million in 1990 to 7.3 to 21.3 million by 2050 in India. So better clinical and functional outcomes in extracapsular proximal femur fractures is the effectiveness of cephalomedullary nailing, particularly beneficial for the patients with low bone quality and limited compliance. So small incision, shorter operative time, reduced blood loss, and reduced transfusion requirements are the benefits of the cephalomedullary nailing. Current status of and future directions. Literature calls for larger studies for greater acceptance of the cephalomedullary nailing efficacy. Present study aims to validate existing knowledge and address relevant factors. So ethical consideration, institutional ethical review board approval obtained, informed consent obtained from all patients. Materials and methods. So prospective study design, we include the 140 patients who are aged 18 years and above. All patients underwent treatment with the cephalomedullary nails for extracapsular proximal femur fractures. Data collection is from the October 2016 to 2017. Mean age is the 19 to 100 years. Gender distribution is 56.4% males and 43.6 females. Mechanism of injury, about 87.1% are slip and fall, 12.9% root type accidents. Patients aged 18 years and more with extracapsular proximal femur fractures are included, and patients less than 18 years with pathological fractures are excluded from the study design. Standard radiographs performed, that is the pelvis with both hips, anteroposterior view, lateral view of the affected hip, and ipsilateral full-length femur with knee. Neck shaft angle measured for affected and unaffected side. Fracture classification, revised EVO classification used. Surgical techniques, spinal block preferred unless and until contraindicated. Lateral position given is given to the patient, and opposite lower limb flexed limb flexed at hip and knee. Affected limb is resting in neutral position on normal lower limb. Reduction, fracture reduced with manual traction and internal rotation. Bone hook is used for large posterior medial fragment with deep. Surgical approach is the lateral approach we have used. Post-operative management, rehabilitation, in-bed exercises started for glutea, hamstring, and the quadriceps. Weight bearing, walker assisted weight bearing or non-weight bearing, follow-up assessment, range of motion, and we use the Harris hip score system. Radiological assessment is used for the fracture reduction, union status, neck shaft angle, and neck length ratio monitored. Any helical blade backout, migration, or implant failure documented. So primary variables, age, sex, and type of fracture. Functional outcome measured using the short forms 36 questionnaire and 1 year follow-up. The patient follow-up, all patients were followed up for the 12 months, that is 1 year. EVO classification is used. Close reduction internal fixation and open reduction internal fixation, both methods used for the reduction. Range of motion, that is mean flexion 116, mean abduction 38, mean adduction 28, mean internal rotation 33, and external rotation 38. So external and internal rotation showed statistically insignificant but clinically insignificant differences. Harris hip score, that is significant improvement from 6 weeks to 1 year. Excellent Harris hip score in 37.1%, good Harris hip score in 62%. Age and gender comparisons, there is no significant differences in the Harris hip score between the age groups or genders. SF36 scores, significant difference between the age group less than 16 years and more than 60 years. Weight bearing status, no significant difference among the EVO subtypes. Complication rate is 4.29%, and that complications are the peri-implant fractures, surgical site infections, and helical blade migration reported. Successful management done, that is including long cephalomedullary nail. Antibiotics started for the infections and local debridement done. Implant removal done in case of the severe infections. Radiological findings, significant change in the neck shaft angle observed. No significant association between the neck shaft angle or neck length ratio and occurrence of the limb. Whereas change in the neck shaft angle and neck length ratio were associated with the limping in previous studies but not in our study. Intramedullary fixation demonstrated more reliable result and shorter operative time compared to the surface fixation. Improvement in Harris hip score observed in our study design with the findings from literature. Cephalomedullary nails potentially provide better stability and earlier weight bearing compared to the surface fixation. Our study reflects similar findings with average full weight bearing achieved at 9.9 weeks. Comparing short and the long cephalomedullary nails, Similar outcomes were observed between the short and long cephalomedullary nails with shorter operative time. Complications, various complications associated with the nail include non-union implant failure and screw cutout. Avoidance of the strategy using long nails with single helical blade. Our study encountered 6 complications and managed with appropriate interventions. Non-randomized study design and small sample size were limitations and short 1-year follow-up. So these are the X-rays. This is the first case, is the 80 years male with AO31 A2 fractures left hip. That is, he was treated with close reduction internal fixation, follow up at the 1 year. Second, also 27-year female, that is 1 year follow. Functional outcome, that is cephalomedullary nailing, demonstrates the excellent functional outcome. Regardless of age, sex, patient benefits from early mobilization, improved functional range of mobility. In case of extracapsular proximal femur fracture, subtrochanteric extension, reverse oblique patterns, long nail are preferred. These preferences ensure optimal stabilization and facilitate successful outcomes. So, impact of limb occurrence appears independent of the change in the neck shaft angle and the neck length ratio. Implications and future directions. Cephalomedullary nailing stands as a reliable option for the surgical management of the extracapsular proximal femoral fractures, offering patients the prospect of improved function, recovery, and mobility. Further research endeavors should explore factors influencing postoperative gait abnormalities and optimized treatment strategy. So these are the references. Thank you, sir.